Hi, everyone, and thank you for joining us for today's webinar, Transforming Fitness Clubs into Health Hubs. I'm Jason Aslanian, the Membership Experience Director here at the Medical Fitness Association. I'd like to take a brief moment to introduce today's presenter. Debbie Bellenger is a health and wellness consultant currently working full-time as Director of Health and Wellness for Pinnacle Health Management. Debbie has an extensive medical wellness background and spent 22 years working as a director of wellness for two hospital systems in South Carolina and North Carolina. She is the 2017 IDEA Program Director of the Year Award winner and the 2014 MFA Program Director of the Year Award winner. She has a passion for population health work and creating opportunities for individuals to get health and wellness education to be able to change lifestyle habits and feel better. In her personal time, she loves to travel and road bike, and she loves the MFA. A copy of today's presentation slides can be found in the handout section of the toolbar. If you have any questions as we move through today's webinar, please type them in the question or chat section of your toolbar. All questions will be answered at the end in the order they were received. Okay, Debbie, take it away.
Thanks, Jason. Well, good morning, everyone, or good afternoon, depending on where you are. As Jason said, I'm absolutely thrilled to share some time with you today. Those in my world know that this is a very passionate topic for me. And having spent, as Jason said, 20 plus years in healthcare systems as the Director of Wellness, I'm proud to say I was well mentored and well trained and learned a lot about population health and all that goes into the tenets of good health in the broader scope of things that I had ever learned in my fitness career, quote unquote. So I'm delighted to share this today with you. And I'll just get started. Of course, we'll be happy to take some questions at the end. And here we go. So let me just first start by saying the slide, the picture. To me, I'm not a surfer, but this picture resonated with me because I believe we are in the midst of a tsunami. And it's all in favor of everything health and wellness, the way I see it. I think opportunities are just going to bust wide open for us to be able to do the very best work that we all know how to do. And so this slide is magic for me. It represents the tsunami of opportunity in health and wellness programming, healthcare, care in general, whatever language you want to use. I do believe the world is ripe for our services and to feel better. I truly do. So you'll see this picture throughout. So transforming fitness clubs into health hubs and why now? The learning objectives of today, I would like to review the evolving landscape of health issues in America, to identify the gaps in providing health education in communities, to identify the differences between fitness clubs and health clubs, to highlight that the fitness club model is not improving health outcomes, and to identify potential partners in this transformation. Transforming fitness clubs into health hubs. Why now? So there's so much going on in our world right now. And there's so much research, and I know there's going to be tons more. So just to level set, I have pulled some nuggets of data from sources that I rely on in best practice research, program development, staying educated myself. And so some of these stats are clearly alarming, although I would say that everyone in this call probably is not surprised by these stats, as we are in medical wellness, medical fitness. We are close to this data. But just to give us a sense of what we're facing, the CDC has reported that obesity worsened the outcomes from COVID. We are all aware of this. And anyone that was going into the pandemic with health conditions of any sort really have been, and it's proven to be at much higher risk than the healthy for the most part. The CDC forecasts obesity to exceed 50% in Americans by 2030, we all know 2:30 will be here before we know it. Time just flies, and we have so much work to do here. The American Psychological Association reported that 47% of Americans delayed or canceled healthcare services since the start of the pandemic. For many reasons, folks were not going to the doctor, continue to not go. That does not help our overarching health stats in America when folks are not close to their provider, staying current in the health conversation as an individual. The American Psychological Association also reported that 53% of Americans have been less active than they wanted. And I think this one is powerful and maybe a little more surprising. It's easy to get caught up in the media of large brand names and digital platforms. And if you just looked at the news or LinkedIn or other sources, you would think that Americans have got very busy being active last year with the pandemic. And honestly, those that need us most still need us, and probably more so than ever with isolation and other elements. So activity levels have not zoomed up as some large brands are suggesting. In fact, it has gone the other way. And we all know that behavior change is tough and we need community. And in the fitness club model, there is, and this is a generalization on my part, so please forgive me, I'm not trying to be offensive in any way, but having worked in the industry my entire life, both in a fitness club, in a medical wellness center, working for hospitals, all of it, I know that you could have the best of intentions and want to get healthy, but you will need support. Even for those of us who are healthy and fit, and I'll speak from personal experience, going into the COVID pandemic last March with a worldwide shutdown, our normal behaviors changed. And so it's really hard to do things on your own. And I think as an industry, we need to recognize this and understand that the one-on-one model, join a gym, go in, do your own thing, is very much not the norm. And clearly our health stats show that. And so those that need us most, that's where the community comes in, and having programming and opportunities for like-minded individuals to be supported with like-minded individuals, and a culture of everyone is welcome. And sustainability comes from having that support over time. Behavior change is just tough. So think Weight Watchers model, right? Why are they so successful? Why does that continue to thrive? They have accountability meetings, they have weigh-ins, and they have many other things now too. So just some things that top of mind in my life work experience, I've noticed that create some of the differences that we've been experiencing. Jason, I'm going to reach out to you. I think my slide deck is frozen. Is that possible?
Can you try the arrows?
Yes. And they are not, let me see. No, they're not moving forward. What is happening here? Sorry, folks. Here we go. All right. Apologies. Okay, back on track. Technology is supposed to help us, right? Okay, so some more data, some nuggets of data for us to kind of level set where we are with health in America and how we fit into this conversation. So there's also data to show that stroke prevalence is expected to rise 21% by 2030. So one of the things that the pandemic clearly has created is an evolution of stress unlike anything that we've encountered. Not that our ancestors maybe not have encountered, but for us currently, continual change, constant not knowing what the next day is going to bring, masks on, masks off, all of these things have created a great deal of stress for folks. And so stroke prevalence is expected to rise. 31% of stroke patients are expected to need speech therapy. More than 1.2 million Americans are projected to have Parkinson's disease. And COVID has further spurred the drastic increase and caused an immediate rise in medically complex patients with multiple comorbidities. Not that we don't have enough going on with the epidemic of obesity in America, these other disease states and conditions will be things that we as wellness professionals will need to be facing. So with all that's going on in health in America, where are the gaps? Again, this is based on my work experience, my reading, my education thus far, and I'm imagining a lot of you on this call could potentially add a lot more to this conversation. So I see gaps in opportunities for our providers to refer patients to classes, programs, communities for pre-diabetics, for obese individuals, for pre-hypertensive, hypertensive, you name it. Where do doctors, providers refer in your community? If you'll take a moment to just think of this, if there's no medical wellness center in your community, where do providers refer this population? I just was at DCAC Fitness Convention, the first live fitness convention last weekend in Virginia. Amazing, scary, fun, everything above. And I met a longtime fitness friend that I had not seen in a very long time. And we got to sit and chat. And she was like, "Hey, Deb." And we know each other from Canada Fitness Day. So that's many, many moons ago. And she's like, "What have you been up to? Tell me what you've been up to." And I shared a little bit of my career path since moving to the States. And she's like, "Where do we find these things?" She's in Orlando now. "Where do we find these programs? You did what? We need programs like you had at Claremont in South Carolina and North Carolina. Where do we find these things?" And it just reiterated top of mind, there's just not enough opportunity for folks to have a referral from their provider to a program to support behavior change in these different areas. Some of the other gaps, and this has escalated and truly become more evident for me since the pandemic, insurance companies, this was before, but even more so now, focus very much on online learning. So if you're with Blue Cross Blue Shield and you want to gather some points for your employer wellness program, you're going to do that in a one-on-one online learning platform. So there might be challenges and such, there might be a community forum, but that typically caters to those individuals who are already mindful about their health and wellness, somewhat self-motivated and interested, and clearly it's folks that remain in the workforce. So it's the working age population. I also see gaps where we now have competitors in our space, and I feel very passionate about this, not good, bad, or ugly. It's just a reminder that there's so much work for us to do in medical fitness still. So much work, so much opportunity. Pharmacies are creating health hubs, putting conference rooms and patient rooms in their bricks and mortar spaces. So clearly they are moving into their version of a health and wellness space. Again, not good, bad, or ugly, but for me, the overarching conversation is continuum of care and how we all work together. There's just plenty of work for all of us in trying to get Americans healthier than we are and where we're going currently. The virtual education that has just imploded itself and exploded itself in this last year is mostly one-on-one that I've seen. And I've done extensive research in this area, just looking to see who's going to move into the virtual wellness programming space. I've seen a couple, but not a lot. And again, this one-on-one platform, it's the catalyst to engage means you have to be motivated in the first place to load up your laptop and participate in an exercise program or a class. So the do-it-yourself model is very prevalent at this time. Group instruction creates the community culture and sustainability that's needed in ongoing behavior change. So I am very much, and if you know my career and you know me, wellness programming, customizing programming, deliverables for programming for patients, community folks, employers, that's my jam. That's what I love to do. Because in my mind, you just need to meet folks where they are and lead them by virtue of creating group opportunity. And the group is the glue, the magic, the fairy dust that helps folks get motivated and stay motivated who maybe would otherwise not commit to health education. And then fundamentally, we within our industry, and when I say our industry, I am pulling in the fitness industry, health, wellness, fitness, medical wellness, whatever language you use, there has got to be a greater connection to the providers in having a conversation around health and the understanding and appreciation of the role of a provider in monitoring you and your loved ones through their lifelong journey, the ages and stages of growing older. We all have life events, and the key piece here for me is the provider. And so us getting connected with the providers in the wellness offerings that we have is absolutely crucial, more so now than it's ever been. So transforming fitness clubs, a few more ideas came to mind when I was thinking about this session and preparing it. Again, it's very passionate for me. I do not relate to conversations with fitness professionals in my world in the language that return to normal, return to pre-COVID, we're just going to pivot. I don't believe any of that to be true. We will never return to anything. So I think that the goal there is that we get to create the new norm. We get to be a part of the conversation of how we can connect communities to get people to better health. So I think this is a good thing. I don't think aspiring to what we knew prior to is going to help us in any way, shape, or form to move the needle in population health. I just think we need to let it go and embrace the new. The transformation for us in the industry, fitness and wellness industry, could be life or death, I believe, for many bricks and mortar facilities. If more facilities could embrace the concept of health and wellness programming, health education for their members, and make their fitness club more into a health hub, we would have a much greater impact, I do believe, over time. And one of the last stats I saw, by September 1st of last year, I was unemployed, so I had a lot of time to be on LinkedIn, do webinars with other groups, step out of my comfort zone and listen into many different groups, different sessions. And I do recall a stat, I don't remember which agency or which webinar I was on, but the stat at the time was that by September 1 of 2020, over 300,000 fitness professionals had lost jobs, not ever to return. And the forecast at that time was that fitness centers, as we know them, 30% of those were going to close and never reopen. And so these are very critical things to think about in how we are going to create sustainability in the fitness club model. And I do think it is in transform them into health hubs now more than ever. The biggest piece of our work, my experience has been, is that it's relational. It's about people. It's about heart. We have to connect with people to be able to create behavior change. It's not fitness center memberships that improve health. Clearly that does not work. Do we need technology? Absolutely. But we also need to learn how to use the technology to create experiences that are customer-centric, the voice of the customer, that meet people where they are. And technology is part of the solution, but it is not the answer. We need it, but we have to learn to play with it. And that's something I feel as an industry we can become more sophisticated in. And I will be the first to let you know, old dogs can learn new tricks. One of the blessings of being unemployed for 9 months, I can't believe I'm saying that out loud, but true story, I did lose my job, is that I've had time. I've had time to teach myself how to do lots of things on the computer, webinars, Zooms, all kinds of things that I didn't know how to do prior to, because I was just so desk bound and so busy. So yes, we can learn. I do believe we need to be ready to receive and remove barriers for consumers. Do we actually know what unfit, demotivated, obese, arthritic adults need? Do we know how to meet them where they are? What motivates them? What makes them feel better? And I think at the core of this conversation for me and my life work, it's all heart centric. It's creating a relationship with someone, recognizing an opportunity that today is the day that Jason's decided he wants to be healthier. And today is the day that Jason's decided he's going to buy a Fitbit or an Apple Watch or look at his phone and use an app that's already there and start tracking steps. Part one. So behavior change is us as professionals recognizing those moments and embracing the individuals. It's like, hey, Jason, this is awesome. What is it you're going to do? Well, I don't know. I'm just going to load the app on my phone and I'm going to walk more. Do you have a goal? And you start the conversation, you start the relationship. This is at the core of the work that we're doing. And I know that I'm preaching to the choir because I'm sure everyone feels the same that is participating today. So our industry needs to step up and create step down offerings for our patients, or is it now step up offerings? So when I was running my medical wellness centers, both in South Carolina and North Carolina, cardiac patients have a heart event, go into emergency, go to inpatient, phase 1, go down to the basement of the hospital, phase 2, cardiac rehab with monitors and nurses, and come to Debbie and her team at Caremont Health and Fitness Center for cardiac phase 3 step down. We used to call them step down. I want to change that language. I think we should now call it step up offerings. That's what I think we're going to do. So if I have the blessing to ever have a medical wellness center in my career again, that's going to be my new name. All right, so moving along. Again, transforming fitness clubs into health hubs. Why now? Clearly, fitness center memberships do not improve health outcomes. Again, a huge global statement on my part, but it is just not happening. It is not thousands, millions, however many bazillions memberships to fitness clubs in America, and yet our health stats continue to waver and forecasting 50% obesity. It's just, that one's hard to get my brain around. So we need an increased awareness of the value of good health post-COVID. I do believe that's the lining here, is that there has been an increased awareness, more conversation about being healthy. For those that have had COVID and coming out the other sides of it, where do they engage to learn how to be healthier and to sustain that going forward? If it's motivated by fear and that's the catalyst that gets them into our centers so we can take care of them, so be it. But we should be ready to receive them and help them in their lifestyle education so they can have the best possible life after having the trauma of COVID. There are gaps in deliverables for quality education. So I've referenced this a little bit. If you look in your own community, what top of mind comes to you? My mom just had a heart attack. Where can I refer her? Where can mom go? And it's interesting. It's like anything else in fitness and certifications. If I use that example, having lived in Canada, I'm moving to the States, and I've lived all over in the States with my career. You know, one club will want this certification and another club will want that certification, and that's all good. But clearly, the medical wellness industry has been embraced in more states than others. And we just need to blow it up, guys. We need to blow it up. This is the right time. We have, in reality, providers, when you go to your annual well visit, to your doctor for a sinus infection, whatever it might be, we all know that the time with your provider is incredibly limited. At the end of the day, these providers are not our health and wellness coaches. You might meet a provider that's very wellness minded and lean in heavily to that conversation with you and be well connected with a medical wellness center locally in town. But that's not the norm. That's not the norm. And having been in healthcare 23 years, working for hospital systems, I also know about ICD-10 codes and billing and providers who will not diagnose a patient with obesity because they don't want that ICD-10 code. Conversely, it'll be overdiagnosed in different areas, but because they don't want a patient to feel badly about having a BMI that ranks them as obese. So there's just so much opportunity for us to be the folks to receive these patients where we can embrace them and provide quality time and education and learning and answer questions and provide resources. The actual visit time with the provider these days for a well visit is about 15 minutes. And they're typing on their computer half the time they're speaking with you. So it's an opportunity for us to step up, truly. And in general, if we look at fitness, health, and wellness, fitness clubs, are most fitness clubs creating safe spaces for non-exercisers, new exercisers, COVID recoveries, overweight, out of shape, special populations? I don't think they are. My experience has been, having lived all over America, that that is not the norm. In fact, you have to search for these programs. I remember in South Carolina, let me just tell a little story. The overweight and out of shape reminded me. So when I moved from Houston, Texas to Columbia, South Carolina, that was my first job as a director of wellness for a hospital system. I had never worked for a healthcare system before. And so it was the start of me learning about population health and just becoming a little more sophisticated in the work, crossing T's, dotting I's, health outcomes, data is everything, all this mindset of the population health work that we do. And I remember I hired on as the manager, and there were 6 retail spaces with Group X going on. We didn't have our medical wellness center yet. And so it was just these little leased spaces where the local community could come and do fitness classes with us. And so I went to my director and I said, you know, we've got a lot of XYZ classes, but we really don't have any for the beginners. Can I offer an overweight and out of shape class? To this day, I'll remember, I'll never forget her saying, have you lost your mind? You can't say that. I'm like, why not? How do they know where they fit? She said, no, we can't do it. I'm like, just let me try. Just let me try. I'll find the right instructor. I will own it. If it creates offense, I will own it. Can I please try? I'm the new girl. I just want to try. And she finally said, all right, I got your back. You can do it. So we did it. And that was, and I'll never forget it. The instructor that I got had a dance background. She was not, excuse the expression, a skinny mini. Tuesday, Thursday night at 7 p.m. We ran out of space. The class was slammed packed. 120 participants, like-minded, having a blast, dancing around with Mel. And when she quit teaching, she went off to college. The class numbers just dropped. But anyways, funny little aside, one of my life experiences in work. All right, so why now? Healthcare spend in America is not sustainable. We just cannot continue in the way we're going. I'm currently working for a health management TPA insurance company out of Irvine, California. And the claims, I'm running reports fairly regularly. As we all know, diabetes, obesity, clearly at the top of the list. Hypertension has just exploded. The average American, let me back up, excuse me. Average healthy American on a health plan today will cost a company $7,000 per year. Well, guess what? There's very few employees in that low risk pyramid score. So it's just not sustainable. This is just going to implode. The employer insurance will fill the gap for only so long. Companies will eat the costs for only so long, and then employees are going to have to shoulder the burden of a 14% increase in health insurance. My company, the one I'm working for, it was 17% last year. At some point, that's going to be a stopgap. That is not sustainable. And so what I fear is, and what I'm seeing in the work I'm doing with this company, is that employees just decide I'm not going to get health insurance. I'm not going to bother. I'm just not going to the doctor. That is also not a proactive position to be in. And so clearly we have got to get connected with lots of different groups to spread the message of health and wellness and provide them strategies and step up opportunities and programming to change this trend. We're no longer talking about zero trends in healthcare. It's so far gone at this point, and we need to get back to that. So when employees don't elect healthcare insurance and they don't go to the doctor, the chance of them becoming sicker and more costly over time is very real. And again, it's just the whole model is it's not sustainable, and employers aren't going to be able to carry the burden. It's just it's going to have to change. So again, an opportunity for us as health and wellness professionals. So I believe we need an integrated health and wellness hub that delivers a full suite of well-being offerings, to include nutrition, behavioral health, movement, this well-being, whatever you want to call it, pre-diabetes, pre-hypertension, recover your health post-COVID, whatever it is, opportunities with the appropriate staff and credentials. Let me highlight that. We need to be providing these programs and services. So again, not trying to be offensive. This is just observations from my career. And I've worked and managed fitness clubs and medical wellness centers both. Fitness clubs typically focus on sales driven by memberships. Marketing around from inside fitness clubs often focuses on body ideals and not health improvements. And the centers that I've been responsible for managing, I worked very closely with my marketing departments and teams to make sure that pictograms, pictures, anything at all that we were using was appropriate for all sizes, all shapes, all ages. You would never have seen on a piece of marketing content from my group an individual on the front of a brochure that had a bra top, bare belly, and leggings. Never, ever, ever. I also did not permit that in my centers, that we had uniforms, dress code, as I'm sure you all do. But we're marketing to different things. One is sales driven, and our model in medical wellness is health outcome driven. Very, very different conversations and strategies to get to the end game. Fitness clubs are often exclusive in culture. How many times have you in your life walked into a center and thought, or a gym, or a club, or whatever you want to call it, and felt that you didn't belong? And yet we're in the industry. And there will be a massive increase in boutique clubs. It's already starting now on the heels of pandemic. That will be one group that will probably continue to grow and thrive. So we really need to create cultures. I've traveled all over the country and Europe presenting for Reebok as a Reebok master trainer, for TRX as a master trainer. I can't tell you the number of facilities that I've been in my career. That's been my weekend fun job. And you can tell the culture within 2 minutes of stepping into the front doors and walking up to reception. Mark my words, I could tell if it was customer focused, customer centric, or if it was something else that was going on within the culture. Again, I'm not trying to be demeaning. I'm just sharing my experience having grown up in this industry. And non-existent dress codes or dress codes that you absolutely would not bring a 9-year-old boy or girl to just because you'd be like, oh, I don't want my children to see that outfit. These kinds of things we need to be really mindful of. The fitness club's experience for me has been that one size fits all. You either you pay for a membership and here's what we offer. Take it or leave it. And my experience in medical wellness is all about how can I help you? Where are you in your journey? Let me provide you hope that you can do this and feel better and live the life of your dreams. Yes, you can start walking. Yes, you can go hike XYZ trail with your grandchildren. We can get you there. Customization, meeting individuals where they are in their health journey is everything. Personal training. How many facilities run personal training with absolutely no measurable outcomes? That cannot continue. That's just, and again, forgive me for this, I have big opinions on this. I label it as passion. It doesn't make sense. It just doesn't make sense. Hire a personal trainer, but have no definitive outcomes around the value of your training and improving your health. Again, I'm making a generalization. I'm sure the folks on this call in your centers, you do have all of this going on, but so powerful for the conversation of improving health over time. And fitness clubs are not focused on integration. They're not aware that there's a bigger overarching group that we need to be connected with, and that's our primary care providers and our specialty to create a more robust care for individuals in fitness centers. We have lots of experts in our communities, and we need to hold hands with them and make magic happen. We seriously need to do that. Health hubs, on the other side of this conversation, I do believe we, as an industry with MFA, we are focused on a continuum of care model. So I think it behooves us as a very talented group on this call and in this industry to share our learnings, our education, and our sophistication in the work with others in the industry that don't know how to do the work the way we do. I think the mentoring piece of the conversation comes in because we know how to do the work, and that's really, really key. So focusing our medical wellness centers, we focus on the continuum of care model. We get it, it's a circle, right? We embrace referrals from providers. We make those connections happen. So we know, they know that their patients can come to us and be safe and well taken care of. And we will loop back and close the loop of feedback and give them the resulting data from their patient in our programs. Totally critical. That's a much bigger conversation in ACO world, but it's important. Health improvements are key, so tracking progress over time. Every program that is offered should have pre-post assessments so you can show improvement over time. Data is everything in our world, clearly, and sharing of the data with the providers, that loop back feedback model, really important. Creating outcomes that may lead to reimbursable events. Folks, we need to keep chasing this rainbow. I see the needle moving a little bit in the industry where some of the trainers are able to reimburse if it's deemed clinically necessary for a patient to have a trainer for a particular condition. You might be able to bill insurance. We have a lot of work to do in that space. Hopefully the FIT Act goes through. That would help immensely. But we are all advocates in the work that we're doing, and that's part of our professionalism, is that we are the makers of change and we need to own it. And clearly, our goal in medical fitness centers is creating long-term relationships with our members to monitor their health over time. And I know you all have stories of Jason who joined your center with the family and the kids were little, and then his kids had kids, and now Jason's 85 years old and still coming to your center, and the children come and the grandkids come and all of this. That's just a big happy face on the screen for me. That's the way it should be. That's the way it should be. So some insights from population health and health equity. This is a quote, I think a very powerful one, and one that really resonated with me because the CEO at Caremont, where I've had the most success in my career, just phenomenal success, because it started at the top with the CEO's vision Our tagline for the hospital being your partner in health and wellness. And our brand at the first year of my employment was in love with life. When I saw that, when I interviewed, I thought, oh, I absolutely have to work for this hospital. This is amazing. I don't know these people, but this is amazing. So when I read this, I had heard my CEO from Caramont use almost word for word this language. And so this is from a Healthcare Executive magazine, and I've literally quoted it and sourced it for you. But the CEO shared, life expectancy can vary significantly from neighborhood to neighborhood, even when they're only a short distance apart. A person's ability to access and afford healthcare services can have a direct impact on his or her health outcomes. As a health system CEO, I believe we should be responsible for creating communities of wellness, and we shouldn't limit our scope to caring for the sick or treating diseases. We have to establish meaningful, ongoing care relationships that identify health issues sooner or prevent them from happening. And in my 9 years at Caramont, I heard that over and over from the CEO and the C-suite. We were your partner in health and wellness. And it was magic. It was just magic. And another quote from this particular CEO, I'm as equally invested in our outreach programs as I am in other medical services because they all contribute to the same end goal, and that's keeping people healthy. And this is sourced from Dennis Poulin, President and CEO of Virtual Health out of New Jersey, from the Healthcare Executive magazine from July, August 2021. So another case in point, why do we need health hubs? We need health hubs. So I just did an amazing roundtable on obesity solutions by webinar in July. And in preparing for this session, this particular webinar just hit me like a ton of bricks, knowing that by 2030, 50% of America will be obese. And this is now a disease state as recognized by American Medical Association, so a chronic disease. One of my key takeaways from the webinar is that losing weight is often not just a matter of putting the fork down, joining a gym, and or willpower. It's not that simple. It's not about you not having willpower or your member not having willpower. The obesity condition as a chronic disease needs an integrated approach to care, a clinical approach, an individual approach, family approach, and community systems. And so this one really resonates with me in the work that we do because it's all that we do in population health, in taking care of people. Obesity is chronic, it's not episodic, and it needs long care. I believe good health is also not episodic and short-term care. All of this is what we're doing. This just happens to be obesity, and yet we will all have to have obesity management programs, weight management programs very soon, whatever you want to call them. So this was a really good webinar that I had participated in. So some key data to consider. Consumers spend $109 billion yearly at gyms, fitness studios, fitness clubs. 3.7% of the world population is a member of a health club and or participates in a fitness class regularly. 103 million participate in some version of home fitness. 33.8 million people use a public or free fitness facility, and there are 21,000 outdoor gyms that offer free classes right now. This is sourced from the Fit Summit 2021. I participated. Look at this. Billions being spent, millions doing home fitness, and yet obesity is forecasted to exceed 50% in Americans by 2030. What is wrong with this picture? What is wrong with this picture? Fitness memberships do not equal improved health outcomes. Also in the care economy space, in workplace, let me back up. There's a $648 billion explosion in the care economy. Huge money is being invested right now, folks. Incredible amounts of money in the care space. We are in the care space. Workplace, 42% of employers plan to add or expand care as part of their benefits. $136 billion childcare market that has desperate need for supply. Aging in place. Insurers and startups are innovating quickly to meet demands for older adults to age at home. Anybody heard of Upside Home? Household management. Families want to buy back time. There's a $217 billion opportunity to be unlocked in the care economy space. We need to be part of this. Pivotal Ventures is a very large group that has a lot of money and interest in health and wellness. So the question to us as professionals, the call to action for us as professionals, how do we become part of this care solution and get our piece of this market? How do we make that happen? We find partners outside of our own industry who need us. Healthcare, partner with your healthcare systems. Clearly, we know how to do that. Hospitality, spas, hotels are investing in wellness like crazy. One of the top 2021 wellness trends is spa-like opportunity in travel. Wellness that travels. Treadmills in hotel rooms. It's going to be way more sophisticated than that now. Travel industry, tourism, employers, older adult living communities. The sky is the limit. There is so many folks talking about well-being, wellness, feeling better, and there's a lot of money being invested in this overarching space. So let me close with a couple of really basic, simple tips. I'm preaching to the audience here because I know you guys know all of this. We offer health and wellness programs in our centers, and we offer them without requiring a membership. Now that's in our space. We can do it, I believe. Let them try before they buy by doing a diabetes program in your center, and then enroll them and give them a discount to do so. Just saying. Fitness clubs, that's not the model they live and breathe in. So I think there's more opportunity there. Offering a broad breadth Group X schedule that has a lot of intro type classes, disease specific type classes. Most facilities I know, and a lot of my fitness friends that I've grown up with, don't like offering intro to anything because nobody shows up. And I'm like, shame on you. Shame on you. Intro level classes only need 1 or 2 people or 3 or 4 in them. Shame. Those should be on our schedules. Only offering personal training with pre and post metrics. Partner with local healthcare experts to support education. Create an awareness that this is what we do. We're part of the solution. Don't leave us out of it. Have annual health fairs and annual flu shots in your centers, which I know most of you are already doing. Host a Know Your Numbers event with a local vendor. Again, just create awareness and traction. More people in your center, that's downstream revenue and many other great things that can happen. Add a dietitian to your team. Clearly, as we go forward, this is going to be a requirement. We just need nutrition education more now than ever. Even if it's just part-time or grant funded, it would be a great add with what's going on in the world. Co-mingle your services with other vendors. We are not in competition with each other. We are all in the same game, the same end game, improving health. There is more than enough work for all of us, no matter the space we live and breathe in. So we need to learn to partner and co-mingle. And you can start the journey just by, here's our 12-month wellness calendar. Here's what we're going to do. Have a lunch and learn every month and just take it from there. You are the health and wellness center of your community. You are the go-to for everything, health, wellness, education, population health, whatever you want to call it. Another great article, and just in closing, some of the lessons learned in healthcare, and I do think there's great value in stepping outside of our own industry to learn more. Look at what tourism's doing. Look at what hotels are doing, older adult care, and steal some of their great best practices. Clearly, we've all had to review the cost of operations in this past year, and I'm sure many have had conversations around repositioning ourselves in the market. Who are we now? Who do we remain to be? Who do we want to be? That kind of thing. Have conversation about organic growth versus inorganic growth. things that just naturally will happen as a result of you doing XYZ, offering health and wellness programs. What does that mean downstream? Who are your key partnerships? Who do you need to be partnered with? And the examination of telehealth, again, that could be another session, but telehealth has exploded, although there'll probably be some changes in 2022. The explosion in this space, as I've seen for us, has been in one-on-one nutrition coaching, health and wellness coaching, health coaching, all necessary tools, I believe, in embracing behavioral health change. And so I'll close with, are we ready for the transformation needed? I think we're perfectly poised for the tsunami of change and opportunity. And I would challenge you to leave this call and create your call to action. How do you own it? How do you spread the message? We can all put a little ripple in the water and create our own version of tsunami for population health. I think we can do it. I just totally think it's our time. And with that, I say thank you so very, very much for your time, spending some time with me today. And I look forward to seeing you again. I'll be back in September with a conversation about corporate wellness trends and at the annual convention talking about well-being versus wellness. So sending love to all of you. Do your great work. And again, thank you so much. Jason, I'll hand it back to you. Thank
And
you.
thank you, Debbie, for sharing your knowledge with us today. That was really informative. As we go over the Q&A session, you do have a fan who is listening from Paris. Mr. Fred Hoffman wanted to say hello. He's in Paris
Hi,
attending your webinar today. The first question, can you share how you have had success with trainers billing insurance, and if you have any details on that?
I do not, I have not done it myself, so I will not tackle that question. I know someone in Virginia that has, and I've met with him a couple of times via webinar. I would have to defer that question to him, Jason, and what I can do is reach out to that individual and ask if he might be open to questions and then loop back with you and we could push to the group that's attending today.
Sure, that would be great. Next question, I'm wondering, and this question came in around the time you were speaking about obesity and what's wrong with this picture. The question is, I'm wondering if you think the people who spend money on fitness today are the same group you are discussing. I'm sure there are a lot of people who join a gym and don't go, but they usually drop off quickly. Aren't we talking about the people who aren't going?
Yes, we are talking about the people who aren't going. But in that, the additional layer of conversation that was not so much the reality prior to COVID, I would offer that it's also a lot of folks who are motivated, healthy, fit, well prior to the pandemic who have lost some of their health due to COVID-19. So I think it's a larger audience that we're appealing to than it might have been 18 months ago.
Gotcha. What is your opinion on fitness centers offering outdoor recreation / activity programming, such as gardening for clinical populations?
Love, love, love it. Whatever works, do it, do it, do it. I just did a well-being webinar this morning myself on LinkedIn, and it was about well-being. And I heard some of the coolest, fun things to the point of teaching folks how to make fancy coffees, social groups that start out with how are you feeling, to things like gardening and other activities that are just lifestyle activities. I love it. Whoever said that, way to go.
Next question. I work for a health system and we have implemented some medical fitness programs. We want those to be as accessible as possible to the patients. What is the best way to develop or create a cost for the programs?
That's a good question. I would say the answer to that question is to seek guidance from your immediate supervisor and C-suite and understand the overarching philosophy of what that deliverable should render. And if you have a C-suite that is unfamiliar with wellness programs and value around the programs, then I would encourage you to create a proposal to educate and provide to the C-suite member that you report to, and to say, I would love to offer a prediabetes 8-week program. Here's what I'm thinking. Here's the potential budget of cost. Here's the staff person that's going to lead it. Here's the educational materials that we might have to include, whether there's a cost or not. I would recommend that at first blush, we charge a break-even model so that we just get the cost of recovery back, so that we have outcomes to show the value of the program, to then grow it year over year to marginalize a profit in that program. But you need data to show that your program works. Another way that I learned how to do very cost-effective programming in Caramont was to apply for grants from the hospital. And so I could develop my program using grant monies. I actually got to lead a couple for free, but I got the data. And then I could charge, $125 for an 8-week program. But my first offering, first go round, was grant funded. And sometimes I had to walk my way from, this program is free to you because of the grant monies. And then session 2 that we did, I maybe charged $25 to the next group of participants, to $50 to the next. And over time, an organic growth was, this program clearly has outcomes, and we can say, if you take this 8-week, I'll speak to my weight management program at Caramont, you will, if you do what we're asking, hold our hands, you will lose 8 to 12 pounds. And we had no problem selling it because we had proven outcomes. So those are some strategies, some tactics I would recommend you consider. And do reach out to me by email if you'd like to discuss it further, because I would love to help.
Thanks, Debbie. That looks like all the questions for today. I want to remind all attendees you will receive an email with a speaker evaluation for today's webinar. It includes a spot to indicate which CEC you would like to receive for MFA members. So please be sure to complete the survey and return it to us. Your feedback helps us in planning educational webinars and helps our speakers with their presentation skills. As Debbie had mentioned, she'll be back on September 15th for a webinar entitled Corporate Wellness Changing Landscape. And we'll welcome Debbie back for that one, along with, you can see her at the annual conference this year, October 27th to the 29th in San Antonio, Texas. If you have a topic you'd like to see us cover, or if you have knowledge you would like to share in an educational webinar or even a conference session, please visit the MFA website. Click on education and then click either submit topic ideas or submit presentation for the online form. I want to thank everyone again for joining us today, and to Debbie Bellenger for sharing her knowledge, and we welcome her back on September 15th. Enjoy the rest of your day, everyone. Thanks, Debbie.
Thanks, Jason.